Hello. The Final MBBS Part 2 examinations usually have two types of questions. One is your direct questions and one another is scenario-based questions. It is also called a level 1 questions and level 2 questions depending on the situation. So what is a level 1 question? Level 1 question is a direct question which you may be asked what are the clinical features, management, investigations of typhoid fever. That is a straightforward question. In a level 2 question, similarly, if you are asking regarding typhoid, what happens is that a clinical scenario is given in which multiple clinical features, patient may present with history of fever, with prolonged fever, along with other symptoms. He may have hepatosplenomegaly. So a scenario is given. From this scenario, you have to diagnose the disease condition, and then the other questions will be there. So like your clinical features of the above condition, how will you investigate for the above condition, how will you treat for the above condition. That is how the level 2 questions or clinical scenario questions comes. The problem the students usually face with these sort of questions is basically because since if you don't get the diagnosis correct, you won't get any marks. If it's a long answer question or an essay type question with 15 marks and if you got the wrong diagnosis, then your whole of 15 marks is gone. Similar in a short answer question, if you don't get the diagnosis correct, your whole of the answer, you cannot get any marks for the same. So that is why it is important when you approach level 2 questions, and students usually have some difficulty how to approach them. The usual method, the best method, not called something best, one of the better methods, any good method of approaching a level 2 question, any scenario based question is through a syndromic approach. What's the syndrome? Syndrome is basically a constellation of signs and symptoms. So whenever you get a scenario, there will be some key symptoms and signs or any investigations or any imaging findings that may be there for each question, so that the diagnosis can be reached. So in level 2 questions in undergraduate examinations, mostly you will only have simple questions. It won't be very complicated. So there are certain syndrome, like in typhoid fever, there will be certain things that will be important, signs are important, symptoms are important, that will be used in the question. So you can use those things to make a diagnosis. So different types of questions are there for different systems, especially in typhoid fever, the example that I already given. What is going to happen is that they will say prolonged fever with some diarrhea or respiratory infection in the beginning. There will be a clotted tongue, there will be leukopenia, hepatosplenomegaly, all those things will be there. So blood culture may be there. So these are the things that may give you a clue to the diagnosis. Okay, thank you.